Today we will present whether reusable devices are the future. The life expectancy all over the world is increasing, which has led to an expanding healthcare sector. The expanding healthcare sector correlates to an increasing environmental impact. This is where reusable surgical devices come in. Reusable surgical devices create less waste and are more cost-effective than traditional single-use surgical devices. In this presentation, we will proceed to dissect whether reusable surgical devices are the future of medical devices. The reuse of disposables can be justified on various grounds, including the safety and the cost-effectiveness of this practice. Ethically, the widespread practice of reuse may bring down high healthcare costs and also reduce the huge amount of hospital waste that is generated, thus making reusable equipment more accessible in poorer countries. Safety-wise, reuse of both single-use and multi-use medical devices is a common practice and can result in transmission of infection when appropriate sterilization or reprocessing does not occur. But because of the high cost of single-use items, they are usually reused after sterilization in poor countries. For single-use tools to work, all employees must receive proper training and closely follow the instructions for use for the reusable tools.
The reuse and recycling of medical devices has an important role in lowering costs and reducing the carbon footprint in healthcare globally. According to Health Affairs, a leading journal of health policy thought and research, if hospitals were a country, they would be the fourth largest source of pollution. According to experts, the solution is simple. Reprocess single-use medical devices to eliminate over 7,100 tons of waste. These include surgical instruments like trocars, cardiovascular, intra-aortic balloon pumps, blood pressure cuffs, biopsy forceps, disposable medical scissors, among many others. With advances in medical device manufacturing bringing their costs down, healthcare institutions are now considering devices which are safe, pre-sterilized and save costs for hospitals and patients. Three such innovations include Neurant Medical's minimally invasive surgical device, which is used for the treatment of inflammatory diseases of the nose, ACTU8, a pair of disposable forceps mainly used in ophthalmology, made by American startup Vortex Surgical, and Consus Medical's self-propelled single-use endoscopes.
In recent years, rising costs and infection control have led to the increase of disposable surgical instruments to be used in daily hospital practices, causing a significant strain on eco-efficacy. Accordingly, reusable stainless steel medical tools such as reusable stainless steel scissors have been found to be the most eco-efficient. A pair of reusable stainless steel scissors has the lowest environmental impact, which is 11 times less than plastic disposable scissors and 52 times less than stainless steel disposable scissors. The best performing medical scissors were found to be disposable stainless steel scissors, followed by new reusable stainless steel scissors, with plastic disposable scissors in last place. Due to high costs and wastage of single-use surgical supplies, it is essential to find effective multi-use and recyclable devices. The costs of repairing surgical devices for reuse is determined by the decontamination process, the sterile barrier system, and the lifetime of a surgical device. A sterile barrier system refers to minimum packaging that prevents contamination and helps to sterilize reusable surgical devices. The cost of decontaminating a set of around 30 tools is on average $28, with each tool wrapped individually for around $5. Reusable instruments are more cost-effective than disposable instruments for laparoscopic surgeries.
I will talk about how to reuse single-use surgical devices rationally. So, they require categorization in order to receive an appropriate cleaning process. The reprocessing of such a device after it has been used must guarantee that they are sterile, properly functioning, and will not pose a potential risk to the patients who use it, depending on what they will contact, such as blood, mucous membranes, or skin. Device can be classified as critical, semi-critical, or non-critical, as shown in the PowerPoint. In addition, in 2000, the FDA focused on this issue and released a document about requirements for the reprocessed devices, and we can use it as instructions.
Reusable devices become soiled and contaminated with microorganisms when used on patients, and inadequate cleaning between patient uses can result in the retention of blood, tissue, and other biological debris in certain types of reusable medical devices. This can further lead to healthcare-associated infections, and the potential for outbreaks of infection remains an important public health concern. So the FDA is taking steps to reduce the risk of infection from reprocessed, reusable devices, and as a public health agency, it raises awareness of public health concerns and promotes collaboration amongst all stakeholders, including manufacturers, healthcare facilities and staff, accrediting organizations, professional organizations, standard-setting organizations, and government agencies.
Due to the low cost and environmental reason, more and more healthcare organizations are becoming increasingly concerned about reprocessing single-use devices. In the future, there are two things that we need to focus on. To begin with, cooperating with the drug regulatory department to strengthen research is imperative. In addition, the drug regulatory department should require or encourage enterprises to develop and produce reusable medical devices. For those devices that cannot be reused, they should try to find an equivalent substitute or materials.
Due to the stated ethics, safety, costs, efficacy, innovations, rational use, and community issues, it is clear that reusable surgical devices are superior and the future of healthcare, and will thus become more mainstream as the future trends predict. And these are our references.